And good afternoon, everybody. I'm Scott Swan here at Channel 13. We're getting ready for the governor's update on COVID-19 and the mitigation that is underway across the state. The governor will be answering questions along with the health commissioner any moment over at the State House. We'll get to that just as soon as, and he's up at the podium. Let's listen in.
Joining us on this Thursday afternoon, we'll hear from Dr. Box with some medical updates, some numbers, testing, case numbers. And then we'll also hear from the Commissioner of the Department of Workforce Development, Commissioner Fred Payne, on some new numbers that are out every Thursday. But before we get into that, I just wanted to say something at the outset. We've heard from many Hoosiers across the state of Indiana, and I certainly and personally understand that there is no more spiritually important week for many believers than the week that we currently find ourselves in. I'm personally comforted by the fact that in Matthew 18:20 it says, "For where 2 or 3 are gathered together in my name, there am I." And of course, that's a pretty powerful reminder that it's 2 or 3, not 200 or 300 or 2,000 or 3,000. It's emphasizing, of course, that it is the church body, not the building, no matter how architecturally awesome or beautiful that structure may be, but it's the actual body and the church's body's relationship with the higher above that is most important. In the faith of my Jewish friends, of course, Passover started yesterday. Today, for Christians, another important day. Of course, today is the day that Jesus put a towel around his waist and he washed the feet of his disciples. And I would just submit to everyone that it's time to wash some feet without touching them. It's time for our families and our neighbors to stay safe. It's time to serve them in this way through distancing. It's time to serve them by checking in on them. It's time to serve them by providing food and by providing protection for those who are in need. And it's time to serve them by respecting life, by not potentially transferring a virus. My faith teaches me, in fact, it's a command of Jesus, that we are to love God and we are to love others. And during this week, for those who celebrate the sacrifice of Jesus, we're reminded that there is no greater love or sacrifice at this time than to do what we can to keep others safe. And staying inside, I know, is a sacrifice, but it's also a tremendous demonstration of love. And yes, we know that among these three, faith, hope, and love, the greatest of them all is love. And so on this weekend, it is my hope that we choose to worship, those who do choose to worship, do so in an act of love, with respect to others, for your family and for our extended Hoosier family. If that's at home, live streaming a sermon, I'm loving it. If that's taking communion on your sofa, I'm loving it. If that's kneeling in front of a television, is how unique that experience may be, I'm loving it. If that's driving to a church parking lot or out to an empty, tentless field, you must stay inside of your vehicle. This is not a tailgate. There's going to be no physical interaction, as strange or as unusual as it may be with clergy or staff or other participants in that worship service. Your vehicles must contain only those from your household. Your cars need to be spaced out about by 9 feet or more. It's preferred that no communion be handed out, but if so, it has to be prepackaged and it has to meet the current food safety standards. So I would just say to everyone on the coming days, get the word and then get home. My only desire, our only desire, is for your family, for your congregation, the very definition of the word congregation, is for you to be as safe and as strong and as healthy next week as you are this week. And so with that, it is time for Indiana's daily doctor's appointment, I guess you could say, about 2:30 every day, and we'll hear from Dr. Box at the Department of Health.
Thank you, Governor. I have to say that's a tough act to follow, and I think there's no more important message that you'll get today than what the Governor just said. So I am going to start out, unfortunately, with some sobering facts. As you can see on the slide here today, we've had 42 new deaths reported in the last 24 hours. I want to continue to remind you that some of those deaths actually reached back as far as mid-March. About 3/4 or 75% of them are deaths that have occurred since Sunday. So most of it's more recent reporting, but some of them do go a ways back. And that is why yesterday in an order I put out that you had to report these deaths to me and positive COVID-19, and that will take effect tomorrow. Also, the next slide here shows you our reported deaths as broken down by our counties across the state of Indiana. These are incredibly sobering numbers, and they're a stark reminder that we have not reached the peak of this pandemic in this state at this time. So what the Governor said about social distancing is still incredibly important. And the most important thing I would say after whatever worship service you do, it's not the family dinner with 25 or 30 people there. Even the CDC sent out stories about families that had lost 3 individuals because of meeting just for a birthday party or a funeral. So please take that to heart. Please don't expose any of your elderly individuals in your family to that potential risk. While the number of tests reported to us today is lower than what we've been seeing lately, I want to caution Hoosiers that that does not mean that we're out of the woods. This means really there was a lag time in some reports of labs that were reported to us, and they'll be on the actual report tomorrow. That volume fluctuates daily depending on when they arrive at the State Department of Health, and we always catch up the next day on the dashboard. No one should draw any conclusions based on the number of Hoosiers that are tested. Instead, look at the continued high activity that we have through central Indiana and increasing cases in Lake County, St. Joseph County, Allen County, and Decatur counties. We are nowhere near being through our surge, so we need to continue to stay home and keep talking about the precautions amongst ourselves and with our neighbors that we know you should be taking. To illustrate this point, yesterday our strike team collected more than 500 specimens to be tested. In addition, we held our first drive-through clinic in Lake County at Maryville High School and tested in the first day 225 healthcare workers, first responders, and essential workers, which is far beyond our expectations for that first day. We'll be back in Maryville today, and we will continue to be there through next Monday and probably Tuesday. We're continuing to work on other locations and want to remind everyone that these clinics are for people who are healthcare workers, first responders, essential workers, and who have symptoms of COVID-19. A couple of other quick updates. Yesterday I issued an order, as I've already mentioned, requiring that all labs testing Indiana for COVID-19 report all of their negatives in addition to their positive reports within 24 hours. This order takes effect tomorrow, and we'll be sending out more guidance today explaining how you can do this. The purpose is to ensure that we have an accurate baseline to better calculate what percentage of tests are coming back positive in our state. The order also requires that all long-term care facilities, jails, prisons, or other congregate housing facilities report their COVID-19 cases. Also, if their individual employees become ill, and certainly any COVID-19 suspected death or COVID-19 death needs to be reported. And that way, in that congregate setting, ISDH will know we need to be reaching out and finding out what we can do to help you. It's vital that hospitals or local health departments notify the Indiana State Department of Health immediately when a death occurs because it informs our actions. This requirement will help in that reporting. I also need to address continued confusion about personal protective equipment. The State Health Department has a very limited supply of personal protective equipment, most of which has been donated by individuals all across the state. We have distributed everything we received from the Strategic National Stockpile to date, and we, to date, have been able to meet all the needs of any individual long-term care facility, any individual EMS or hospital that has reached out to us. But it is very important that we continue to conserve this and that you continue to understand that we don't have a huge stockpile right here in the state of Indiana to be giving out. I'm incredibly grateful for the assistance we've received from the Colts and from private partners from across the state who have donated these supplies. We are pushing those out where they're needed as quickly as possible. We're not able to order supplies for hospitals or long-term care facilities. We can supplement their supplies. So we've had a couple of long-term care facilities and residential facilities say, oh, well, we don't need to order anymore because the state has this. No, I need you to continue to work your supply chain and continue to get what you can, and then we'll supplement as needed. Finally, I want to remind people about the importance of social distancing. This is an important week, as the governor just mentioned, for religious observances for people across our state. Those observances need to be different than they have been before. The governor's executive order limits the size of gatherings to no more than 10 people. If you do feel the need to go into a field or go into a parking lot, I would say communion should be brought from your own home. Bring your own crackers, your own juice or sparkling wine, whatever, and take that in remembrance of our Lord. Please don't pass out things. That's where I'm concerned that people could get infected. But if you do that, stay in your cars. Go to the bathroom before you leave, and don't get out of your cars for anything except when you reach home again. I wish everyone a very blessed weekend, and I hope that everyone stays healthy and safe.
Thank you, Dr. Box. Fred?
Thank you, Governor. So we all know during the month of March, the weekly unemployment claims numbers pretty much shattered everything that we'd seen before. For the week ending April 4th, we didn't see much different. We tracked about 133,639 unemployment claims that were filed for that week. This is down a little bit from the previous week, but it still posts the second highest number of weekly claims filed in Indiana history. Although we're seeing a high number of claims being filed in Indiana, we're also tracking an extremely large number of claims being paid. So already for the month of April, we've paid out 175,195 payments just up to this date in the month of April. Compare that to April 2019. For the entire month, we paid 71,000 payments. We continue to have high call volume that's associated with our high claims volume. We are having some technical difficulties that we're working on this week. We started with a new contractor, and we're working out all of the kinks in that. But we have had some complaints or some concerns about calls being transferred, and when they're transferred, they end up getting dropped. We're working with our IT team to make sure that that issue is being addressed. We've also seen a number of calls that relate to unemployment compensation benefits, specifically as it relates to pandemic unemployment compensation and pandemic unemployment assistance. So I want to spend a few seconds talking about those two things again. So as a reminder, the pandemic unemployment compensation is an additional $600 weekly payment for claimants who are eligible for unemployment benefits. This payment will be seen in people's paychecks. They will start seeing them around the first week of April 20th. This payment will be retroactive to March 29th. There's nothing additional that a claimant needs to do for that benefit. We will process it along with the person's normal unemployment compensation benefits. For the pandemic unemployment assistance, this is the unemployment insurance payment for an entirely new class of workers, for the independent contractors, for those who are self-employed. As a reminder, our system was not currently designed to address these claimants. This is an entirely new classification of workers that will be paid unemployment compensation benefits. So as we build out our new system, we're looking at a variety of things, and we're working across different state agencies. What we found is this: an individual who falls into one of the categories of an independent contractor or self-employed person, or even someone who will otherwise didn't qualify for benefits, they will apply, and then they end up getting denied. Well, the benefits will continue to be denied because the system does not recognize that classification of individuals just yet. We are working on that system, and once that system is in place, it will recognize you as a beneficiary, and you will start receiving payments. That additional $600 payment under the Pandemic Unemployment Compensation or Assistance Program will be provided to you in the same manner as well. It will be retroactive to March 29th. So what we found is that once an individual ends up applying for that benefit and they get denied, frustration sets in, and understandably so, because a claim was denied. Then the person will call in, and then they will probably be bombarded with maybe the calls, and then they'll have to call several times. Unfortunately, the answer will remain the same until we change our system. The denial will remain in place until there's a new system in place. And once we identify a date certain when that new system or program will be rolled out, we will let you know. We've been cascading information throughout the state on all of our employment systems. We've made sure that we've given the public as much information as we could, and what's been very helpful are the comments that individuals make to us, some of them leaving phone calls, leaving messages, some sending emails. What we do with that information is we take it back to our shop, and then we translate them into a frequently asked question, and we end up providing an answer to that question. So thank you for that. So here's what we've done over the last week to make sure that we're getting the message out and we're answering questions in a more public forum. We've had several webinars this week. We've had several webinars with businesses, some with employees, and we've had over 8,000 individuals register for those webinars. We also held our first Facebook Live event on yesterday, and that event reached more than 140,000 Hoosiers. Next week, we've partnered with Radio 1, and on Tuesday at 1 p.m., Radio 1 is going to stop playing music across all of its bands on WTLC, AM and FM, Hot 96, and Radio Now. And they will be broadcasting some of our insurance, unemployment insurance people talking about this program. So why are we doing these events? We want to provide answers to the general public about what's happening in our unemployment insurance system, about how to file claims, and some of the new benefits that are coming your way. We've also seen that the more information that we put out to you, the better understanding that you have about the overall system, and it reduces your necessity to call in and to our lines to make sure that we are saving your time so that you don't have to wait on a call. In addition to this, we're having on April 23rd, we're going to host a virtual job fair for the healthcare industry up in the Fort Wayne area. We have 5 major healthcare systems that will be featured. We know that there's a shortage, and we know that there's work out there yet to be done. So we want to ensure that we are providing this service to help connect Hoosiers to those needed jobs. So we're all in this together. We'll continue to provide updated information through as many outlets as possible. And just like the governor and just like Dr. Box, I wish you, a great Holy Weekend, and make sure that we all play it safe.
Thank you, Fred. Let me just say very quickly before we get to the questions, our large and small hospital network, each and every one of them have made such a difference. They've really been equation changers, quite frankly, here as they pivoted and all came together and collaborated in preparation and now throughout the duration of this uptick, unprecedented uptick in patient care and need. Their collaboration and coordination has just been nothing short of incredible. And it should give you, it certainly does us, but it should give you a heightened level of confidence and comfort that, yes, we are all in this together. but that we're going to be able to provide answers, and we're going to have the proper avenues to get help. And the help is there, whether it's on the economic front or whether it's on the health front or the safety front. And in difficult times like this, I understand we're all concerned about a lot of things, virtually everything. It's hard to keep up maybe the energy levels, especially if you're one of our healthcare workers, if you're on the front lines, if you're one of those first responders day in and day out. You're not only whipped going home, but you're also concerned about going home if you're taking anything that you caught at work home to your own families. And I think the more and more that I read and talk to and hear from folks all over the state of Indiana, I try to share on a daily basis the good news. The only thing that I think is more contagious than COVID-19, this coronavirus, is the level of Hoosier generosity and kindness. And that will be obviously underscored over this weekend. But it is underscored every single day that we all go through this together. And I'll just very quickly read you one example of this from a family to our healthcare workers. This one's for the team at Johnson Memorial Health down in Franklin, Indiana. And a heartfelt letter arrived there just to express what I'm attempting to. And they said their father, their loved one, had been treated there, and he had passed away. And they wrote these words. They said to the staff at Johnson Memorial Health, it's been so difficult to find the right words to express our deep gratitude and love we have for you. You took care of our dad, our father-in-law, our grandpa, Wally Slade, during his last days. From what we saw, you gave him the kind of love, care, and compassion we would have had we been able to be by his side. We love you for your kindness. Never in the many days Wally was with you did we feel like an inconvenience. You answered our many calls. You kept us informed and even put on your spacesuits so we could see our sweet Wally's face one last time. We love you for your communication. This disease is going to require a long and hard fight. You are strong enough to keep fighting. Families like ours are the reason you need to keep fighting. We need you. Our Wallies need you. We love you for your strength. Patience will heal and patience will pass. But please know, in the end of all this, our family, like so many others, will be forever grateful for you, regardless of the outcome. You have a very big job to do, and we do not take your dedication and your sacrifice for granted. We love you too. We pray for your strength, health, and safety every day. Please don't give up. All our love, Brad, Emily, Katie, and Ben Slade. I just don't think it could be said better at any moment than the Slades did to that staff there at Johnson Memorial Health. And with that, we'll turn to the line of questions.
Eric Berman, WIBC.
Good afternoon, Eric.
There's the button. Good afternoon, Governor. I want to go back to something from a couple of days ago. You said that you were frustrated by the amount of disinformation that still gets out there. What is it that's causing the most issues out there? What is the biggest misconception people have, and how do you combat that and get people to practice good practices?
Yeah, Dr. Box, you want to comment on that? I mean, it's a long list for me. I'll buy Dr. Box a little time. And then, Steve, you might want to talk, if you would, about what you're seeing. I mean, Eric, what we track misinformation or disinformation regarding vaccines, regarding antibodies, regarding trials, regarding where this is, who is immune or who is not immune, how you can contract this disease. It's a long list, and it pops up in different areas by different actors. So I'll turn to Dr. Box first because you're coming from a very clinical perspective, and then Steve, you might talk about it more globally.
That's a really good question, Eric. I guess what I would say is that it is a novel virus, right? It's the novel corona SARS-CoV-2 virus. And so we don't know everything about this virus to start with. We're learning more and more about it. So part of it is that the messaging has changed, and that's made it hard for everyone across the state, for those individuals that work with press, to try to get a handle on this and understand it. But there has been messaging out there about different drugs that are the miracle cure, or different things you can put in your water bottle that's going to prevent you from getting this, or the fact that we have this huge stockpile of PPE here in the state of Indiana that we're holding on to and not giving, or even the concept that there is a large amount of testing available here in states that just isn't being accessed or used. And that makes the messaging all that much more difficult. But I think that the best thing that the governor has helped us with is to make sure that we are transparent and messaging every day the facts as they are, the reality in the state of Indiana, and that's what we continue to have a commitment to.
Thank you. Steve, from a Department of Homeland Security perspective.
Yes, sir. So my name is Steve Cox. I'm the Executive Director of the Indiana Department of Homeland Security. Just like Dr. Box mentioned, there's a lot that is just unknown about this particular illness. And so what that does is it leaves it open for a lot of folks to be able to spread that misinformation using social media platforms and other places out there. It's ever more important right now that you look for a credible source of information. One of the reasons, as I mentioned the other day, that we do these press briefings here is so that we can actually give correct information to the public, so that way we can get out so that the public knows what we're doing, PPE levels, et cetera. Just like Dr. Box mentioned, there are different medications that are being looked at, vaccine questions, all kinds of things that are out there. We're trying to provide those answers. So just make sure that when you're looking for this information, you're using a credible source for your information.
Steve,
Yes, sir.
could you just elaborate, just give a kind of a thumbnail sketch? We'll go more into this next week. But even on the procurement or acquiring what we're seeing around the world, some misinformation.
Sure. Even with procurement of some of the supplies of PPE that are out there, there are multiple different types of masks. It's been very, Dr. Box and her staff have been up front with the types of masks that have been effective. That's the N95 mask. The one issue that always comes up when there's a shortage, then something tries to fill the gap. So there have been a multitude of different types of masks out there that have been put forward. I would leave it to Dr. Box to probably confirm this, but it's very important that people realize the N95 mask is the right mask to be able to use. It's not all of the other types of masks that have been manufactured. There are also counterfeits of those different types of masks being propagated throughout the world right now. So there are a lot of things that we're trying to deal with right now to make sure that our healthcare providers, EMS professionals, et cetera, are receiving the right equipment and the right things that are out there to be able to protect them while they're doing their duties.
Thank you.
I would just add, when we're talking about masks, N95 masks are critical for people that are on that front line where there are aerosol producing procedures, when you're intubating someone or you're giving some type of ventilation treatment, that they need an N95. But the other surgical masks work very well and are great for our other hospital personnel to be wearing when they're not in that procedure where they're generating aerosols. But the important things is that some of the N95s that we've received, obviously we've had the good fortune that one of our hospital systems was willing to test them. And of the 4 that we've sent over, none of them met criteria for being an N95. Now, some that we've been donated lately are amazingly great N95 masks, and so we'll be sharing those and are sharing those already.
Right. And we're also trying to work with other Indiana companies right now to be able to build out appropriate PPE that we know is credible and meets all of the standards that our healthcare workers and first responders need too. So,
yeah, and we'll have some good updates on procurement levels next week.
Kathy Treader, Ferdinand News.
Hello, Kathy. Good afternoon.
Hello, how are you doing?
Very good, thank you. Trust you are as well.
Yes, I am, and I'm going to give a shout out to you first for the community crossing grants in my area. I know they are greatly appreciated. Understand that right now roads aren't necessarily your priority, but they are important, so I did want to give you a shout out.
Well.
Well, we apologize for the technical problems that we're experiencing from the State House today. We're going to go ahead and try to work on that. And while you are doing that, while we're listening and waiting for the governor to go ahead and restart, I want to go ahead and at least update a couple of things from what we've heard today. I think one of the things that we've heard is 133,000 Hoosiers filed for unemployment claims this last week, the second most in Indiana history. Think about all those people who are out of a job and filing for unemployment, 133,000 in 1 week. We heard the state health commissioner say once again, we are not out of the woods. We are nowhere near being through with this surge. So that tells us that here in Indiana, we are still waiting for the peak to come. I think one of the projections that you've been hearing a lot on the news is what the White House has quoted. When will this peak take place? One of the studies from the University of Washington indicated that it may be Easter Sunday when the national peak would take place, and that specific study goes state by state and has indicated that perhaps Indiana would, our peak would take place a week from today on August 16th. So, and again, just some of the other numbers that we're hearing today from the state health department that we have now passed, we're now up to 245 total deaths across Indiana. That is an increase of 42 from yesterday. Some of the demographics that we're getting in those numbers, 88% of the deaths here in Indiana are Hoosiers 60 and older. 60% of the deaths here in Indiana are men, and 55% of the Hoosiers testing positive of COVID-19 are between the age of 40 and 70. And again, Governor Holcomb talked about Easter Sunday coming up and suggested that churches across the state do live streaming, that church buildings would be closed on Easter Sunday, that any drive-through church services that are taking place, that people that are interested in participating need to stay in their car on Easter Sunday. Don't get out of your car if you're going to a drive-in Easter Sunday service, and the people in your car need to be members of your immediate family. So don't bring friends and family in your car. Invite them to go to a drive-in service in their car. That way you keep everyone safe. And the health commissioner, to that end, talking about Easter Sunday services, mentioned that in terms of communion, not to share any of the communion with other people outside of your car. Go ahead and bring communion with you in your vehicle, or if you're going to watch at home, obviously, share it with the immediate members of your family. So it was really neat to hear the governor and the state health commissioner give advice to those of us who will be celebrating Easter Sunday, and having that advice not only for churches to do live streaming, to have the minimum number of people in church buildings to provide those live streams on Sunday, but also reminding those of us who want to participate in drive-through services to stay in our car. Please don't get out of your car and be around people. We need to continue this social distancing. I think that we've heard over the last 24 hours on the national level, Dr. Anthony Fauci and Dr. Deborah Box talking about how this social distancing success is leading to the numbers actually, the projected numbers of deaths actually going down. We heard yesterday at the White House news conference and the coronavirus news conference that, the initial projections, if half the country did social distancing, it would somewhere between 100 and 240,000 deaths. But if everybody participated in social distancing, the new projections are that maybe it might be around 60,000. That's still a lot, but what those numbers reveal is that social distancing works. Staying 6 feet between you and somebody else, staying at home in those states where we do have stay-at-home orders, the quarantine, that is working, that is saving lives. Because as we all know, you can still spread COVID-19 even if you don't show any symptoms yourself. And we want to make sure that we're protecting those frontline workers, the people in hospitals, the people at grocery stores, the people in pharmacies, people that are taking care of providing that frontline care, those first responders. We want to make sure that we're protecting them, because we don't want to pass this coronavirus to anyone else. I think, and again, if you're just joining us, we had some technical difficulties from the Indiana State House. We were in the middle of hearing from the Indiana governor, and I'll just ask our director, once we've reestablished contact with the State House, just to go ahead and put that back up on the screen so our viewers can see it. But in the meantime, I want to also remind you that today is Light It Blue Thursday here in Indiana. And I think what you're going to end up finding across Indianapolis is a number of our iconic places. The Indianapolis Motor Speedway, Lucas Oil Stadium, Monument Circle are going to be lit in blue beginning at 8 p.m., and this is to honor all of the frontline workers, the people that we mentioned, obviously doctors and nurses, lab techs, the people that are working with COVID-19 patients, those people who are on the front lines, our first responders, EMTs, paramedics, those who are in grocery stores, those who are helping out at pharmacies, the people that are coming in contact with large groups of people, putting their own health on the line. We're all asked to wear blue today. So if you're at home watching me, my encouragement to you is participate in blue. If you've got something in blue that you can put out, wrap around your tree tonight, or perhaps go ahead and let us know. I'm going ahead and hearing we're not able to get back to the news conference. So wear blue today as a show of support to the rest of the state of Indiana. So apparently we are having problems with that news conference. Please know that we are getting our best to record whatever else you've missed so we can have that tonight on the news. We've seen a lot of the health commissioner and the governor today. We're going to be putting together stories that are going to serve you, making sure that you've got the facts and not fear. So we're going to go ahead and say goodbye to you for now, return you to regular programming, and we'll see you tonight on 13 News at 5 o'clock. I'm Scott Swan.
You're watching 13 News.